telling you it's unsafe. It's an incredible lie of incredible proportions. Once you understand that, you will be suspicious of everything that follows. So that's where I found myself. There I was in the emergency department, treating patients as they came in with COVID-19. And once we had the rapid test so I could confirm the diagnosis, my first patient, who I needed to give hydroxychloroquine and zinc to, I did it, and even knowing the kind of the controversy, I really didn't think twice about it. I don't know. It was fine. I gave it to her. I actually called her the next day. She was so much better. She herself got better within about 12 hours. In about 48 hours, she was essentially completely well. This completely matched what I had read in the scientific literature. I knew many doctors who had done this. I'd read many journal articles. It was completely consistent. What was really shocking and completely inconsistent was my medical director, who calls me the next day and threatens to fire me for doing this treatment. I can't even tell you even as I describe this moment to you, it's shocking to me. I remember the case, the situation, the conversation, and he's saying he's going to fire me. And I said, why would you fire me over this? Well, I don't think it works. I said, well, then don't prescribe it. You haven't read the science the way I have. I know it works. You'll change your mind in a couple of months when, you get a little wiser. But why would you get involved with me treating a patient? You do your thing, I do my thing. That's how medicine is practiced. We are licensed as individuals. It's actually against the law to have what's called a corporate practice of medicine where, corporation practices for you. It has to be the individual doctor's physician. That's why patients go to multiple doctors, right? And really almost the worst part of the conversation was not even that he was ignorant that the drug worked, but his reasons for saying that he was going to fire me if I did this. And the reason, which he put in writing because he wasn't so smart, he said it was because the biggest payer at that hospital, which is a large insurance company that everyone here has heard of, that's back on the West Coast mainly, didn't want us to prescribe it. They were blocking it. So that payer, insurance company, was pressuring the hospital that their doctor shouldn't do it.
Line workers, before you catch it. The frontline workers, many, many are taking it. I happen to be taking it.
Hydroxychloroquine?
I'm taking it, hydroxychloroquine. Right now, yeah. A couple of weeks ago, I started taking it. Because I think it's good. I've heard a lot of good stories. And if it's not good, I'll tell you right. I'm not going to get hurt by it. It's been around for 40 years for malaria, for lupus, for other things. I take it. Frontline workers take it. A lot of doctors take it. A lot of doctors take it. I take it. I hope to not be able to take it soon because, I hope they come up with some answer. But I think people should be allowed to. I got a letter from a doctor the other day from Westchester, New York, around the area. He didn't want anything. He just said, sir, I have hundreds of patients, and I give them hydroxychloroquine. I give them the Z-Pak, which is zithromycin, and I give them zinc. And out of the hundreds of patients, many hundreds, over 300 patients, I haven't lost one. He said, please keep pressing that, sir. I